Welcome to A Healthy Curiosity, the podcast that explores what it takes to be well in a busy world with self-care strategies from Chinese medicine. I'm your host, Brodie Welch, here to support you on your journey of health, happiness, and personal evolution. Welcome to A Healthy Curiosity. Today we're going to be focusing on breast health. We are awash in a sea of hormone-disrupting chemicals. We're exposed to xenoestrogens or foreign estrogens in our environment from plastics, phthalates in our body products, from meat and dairy, from growth hormone-injected cows. And the majority of breast cancers that women develop are estrogen sensitive. So the more that we mess with our estrogens, the worse that is for the breasts. We discussed some excellent strategies on how to protect ourselves from environmental estrogens on the Living Low Tox episode with Alex Stewart. So if you haven't had a chance to listen to that one, you could certainly check it out. Today we're going to be talking about screening. Breast cancer is a big deal. 1 in 12 women will get invasive breast cancer in her lifetime. It's the number 2 cancers. It's number 2 among cancers affecting women, behind lung cancer at number 1. At my last visit to my OBGYN, I was told that they're now discouraging breast self-exams because of false positives. Meanwhile, we're encouraged to get mammograms. But a 2014 study published in the British Medical Journal found that in a study of 90,000 women over 25 years, there was no difference in mortality rates from all causes in the group that got mammograms versus the group that didn't get them. Mammograms aren't about preventing breast cancer. They're helping to find it early, which sounds good, except that 1 in 5 cancers found with mammograms and led to chemotherapy, surgery, or radiation are not even considered threats to a woman's health. So there's the risk of harm of unnecessary treatment, the risk of repeated radiation, and the risk that comes from the fear that is stirred up unnecessarily. And that is our standard screening tool. So what's a preventative-minded woman to do? As it turns out, there is a non-invasive, painless form of screening known as thermography, which can help us identify inflammatory changes that may exist before a tumor even comes into being. With me to help unpack what thermography is all about is Dr. Carla Garcia. She's a board-certified Doctor of Oriental Medicine with more than 30 years of experience in integrative medicine. Before becoming a Doctor of Oriental Medicine, Carla studied homeopathy, herbs, Western medicine, and European biological medicine. She has studied with and trained physicians in the U.S., Canada, and Germany. Thermography has been at the forefront of her practice since 1999. And in addition to her thriving practice in New Mexico, she does thermography screenings in the Dallas, Texas area. Welcome to the show, Dr. Carla Garcia.
Hi, Brodie. Thank you so much for having me on. It's an absolute delight to speak with you. And I'm especially excited about talking about thermography. It's been out there for quite some time, but there are still a lot of women who've never heard about it.
I run into that a lot. And so why do you think that is? Why is it such an unknown?
I think part of the reason is that there's been no standardization. So it's been around since mammograms were developed, but the way that it was done was it was not necessarily done by licensed professionals. And so what happened is the doctors out there just felt like they weren't getting, a good, accurate description of what was being seen on the images. We highly recommend that you see a thermographer whose reports are written by MDs so that the interpretation of the colors on the images is done by somebody who's had a lot of training in that. So thermography is basically just recording the heat that's being emitted from the body. And there's no radiation going out at the person. It's only the heat radiation coming off of the person that is recorded on the images.
So yeah, my understanding, and maybe for those who don't really know what thermography is about, if you could describe the process of what's involved in a particular exam, because my understanding is that it doesn't involve radiation, it doesn't involve sensitive tissue getting smushed, it doesn't really involve being touched at all. Is that true?
That's absolutely true. So what happens when you have a thermographic scan is that an infrared thermal imaging camera is used to record the heat that's coming off of your body. So it's about as dangerous as taking a photo is with your phone. You're actually your phone is recording the light that's being reflected off of your body. A thermal image, a thermal camera is recording the heat that's being emitted from your body. So what happens is those temperatures are translated into colors. So you'll get a really pretty picture, an image, silhouette with colors that will range from white, red, orange, yellow for the warmer colors, greens and blues for the cooler colors, and black is usually the coldest color. Now, there are different scales, temperature scales, or different color scales that you can use where it goes from red to blue or green to purple or those kind of things. But the most commonly used one is a scale that uses white is hot, black is cold, warmer temperatures as red and yellows, and cooler temperatures as greens and blues. And so then you just see on the picture that's taken those areas. And of course, how that translates is the warmer temperatures can be an indication for inflammation more often than not. The warmer temperatures like the reds and oranges are an indication for inflammation. If you see a lot of splotchy areas of red and orange in the breast, sometimes that can be an indication for estrogen dominance. Now, estrogen dominance does not mean that you have too much estrogen. It means that it's not being balanced properly with progesterone. A lot of the warmer temperatures can be an indication for lymphatic congestion, sinus congestion, that type of thing. And if you have cooler temperatures, if you have an area that's particularly cold, sometimes, and is, bright blue, or black, then sometimes that can be an indication for nerve impingement, muscle entrapment, poor circulation, neuropathy, that type of thing. So basically...
Go ahead. So I was just going to interject that. So it sounds like you can get actually a lot of information about what's going on in the body. Like not just whether the presence of a tumor or not, but because it's indicating the level of blood flow.
Exactly. It's indicating the level of blood flow. And that's the whole thing, is that thermography is not a diagnostic tool. It's a screening tool. But then again, the only true diagnostic is a biopsy or a tissue sample. So mammograms, MRIs, ultrasounds, thermography, they're all screening tools. The only true diagnostic is to actually have a pathology report that comes back from a tissue sample, either biopsy or blood work.
Right, and it is, from my understanding, is that if a breast tissue is biopsied and it's found to be not breast cancer, just having the biopsy in and of itself raises the risk for a non-cancerous tumor to go bad. And that just seems like a bad idea, just invading what is otherwise healthy tissue as little as possible.
Right. I'm not really sure that a biopsy would cause tissue to go bad. It certainly traumatized the area.
Yeah.
And so, that in itself is bad. I think the really bad thing about false positives of any type, whether they're from a mammogram or from thermography or from breast self-exam, is that it's the mind, the patient's mind, going to the worst places. So it's the stress involved with the false positive, to me, that is the most damaging thing. And yes, biopsies are pretty invasive. Now, if it's negative, then you don't have to worry if the biopsy has punctured a benign tumor.
Yeah.
Well, it's unlikely that anything's going to spread because there's no mitotic activity, there's no cancer cells that are going to spread. But you've put the patient through a pretty harrowing experience, and you've also, like you said, it's a pretty invasive. It's not a walk in the park, I don't think, to have that done.
And then the fact that as say in a mammogram situation, that a lot of times results will be unclear, right? And especially with women with fibrocystic or a lot of dense tissue in the breast, and that it's unclear. And so then the solution is, well, let's go back in and do it again. Let's
Right.
yet again irradiate this tissue that is sensitive. And meanwhile, you're stirring up. I can't agree more that the mindset of the person. Cancer is a scary word, and so that having that come up as like this is a risk is very scary for a lot of people. And then if they find something that may not ever be life-threatening, a lot of times I had a close friend of mine who was diagnosed with breast cancer and ended up having a double mastectomy. But it's the kind of cancer that very rarely metastasizes or ever really poses a threat to health. And so it's the kind of thing where it's like, is she better off or not? And it's, I think reasonable people can disagree on that.
Right. And that's the one thing as a practitioner that we who are in the health field need to realize is that it's a very personal journey. Cancer is a very personal journey. And so the best thing that we can do is actually support the patient's choices. A lot of times what happens for a woman who's been diagnosed with breast cancer is that everybody comes out of the woodwork with some kind of recommendation. Well, you should see this doctor, you should do
Yes.
this, right? And they feel just overwhelmed, A, because they've gotten the diagnosis and they don't know what to do, and B, because they're reading different things, and C, because they don't want to disappoint the person who's making the recommendations. So you're right, it's a really difficult time. In relation to dense breast tissue, so the reason that they're requiring repeat mammograms a lot of times if you have dense breast tissue, and we know that more than 45% of women have that.
Yes.
Right. It's actually more a majority of that than there is of any other type of breast tissue. And I don't consider fibrocystic breast tissue a disease, actually. It's very, very common. I don't think it's an illness. But when you have a mammogram, what it's doing is it's actually recording the denser areas or microcalcification. So X-rays are designed for hard tissue, right? For musculoskeletal, for bone,
yeah,
which has calcium in it. So when you're having an X-ray of your breast, they're looking for any calcium deposits in the breast. Now, the problem with that is that they look white. Calcium deposits look white on an X-ray. Now, guess what? So does dense breast tissue. So it's very difficult to discern a white microcalcification from dense breast tissue.
Hence the confusion there with mammography.
Right.
Got it. And so you were mentioning that with thermography, basically it's taking a picture and different colors are that we see warmer colors in area of greater blood flow, and that can indicate cancer because cancer recruits its own blood vessels, correct? Like that's the angiogenesis thing?
You're hired.
All right. Well, it's the idea that I talk about this with my patients all the time in terms of like cancer prevention, and really like one of my common recommendations on keeping ourselves cancer free is to eat less sugar because it's cancer fuel, and it can definitely increase that angiogenesis. So okay, so if we look at a thermograph, is it a thermogram, a thermographic image? What do we call the image that we look at?
It's either one. It's like mammogram,
Okay.
thermograph. And you're right. Tumors recruit their own blood supply. And so what happens is a process called, like you said, angiogenesis, which is the creation of new blood vessels to feed itself. When those new blood vessels are created, they bring more blood flow to the area, and that blood flow is warmer. And that's normally how you see the increase in temperature surrounding, a tumor, is that neovascularity. It can also be warmer because of increased mitotic activity. The actual doubling of the cells is a metabolic process in itself that can sometimes increase heat in the area.
Okay. And this is obviously heat and activity that is of a pathological nature. But I would assume that because the breast is oftentimes, we're wearing bras, we're kind of like constricting the flow of blood and lymph to our breasts throughout, like the breast doesn't really get massaged all that much, and it's not really an area where, that unless we're kind of actively moving the breasts around after taking off bras, it's often an area that has some decreased blood circulation. Do you find that that's true?
I do. And, it's interesting. I've seen recently some ads on TV that say that underwire bras and antiperspirants don't cause breast cancer. I think that's absolutely true. I don't think they cause breast cancer. What I think they cause is inflammation. So what happens is when you wear an underwire bra is that you're causing a lot of restricted movement of the breasts. And so when that happens, they can't bounce. They need to bounce a little bit so that you can actually pump the lymph. The only thing that moves lymph is muscular movement, right? Yeah. So we have blood in our body, and that's pumped by a heart. The only thing that moves lymph is the contraction of muscles around it. And unfortunately, the breast doesn't have a lot of muscle tissue around it, so we need to let it bounce. We need to massage it. And what happens with underwire bras is it totally restricts movement. And in addition to that, that wire actually puts a lot of pressure on the area. So I don't think it is necessarily even has to be underwire. It can just be a really tight, restrictive bra that can be a problem. Then the other and the reason underwire bras in particular can cause a problem is that because right where the wire ends is in the subaxillary, right below the underarm. That's the underarm is where we have the most lymph tissue, right? Mm-hmm. All of our lymph nodes in the upper chest are concentrated in the underarm. Now, what do? We put on antiperspirants to keep from sweating because we don't want to ruin our clothes or we don't want to smell bad. My suggestion is that we not worry so much about sweating and we use natural deodorant so that, yes, you don't have an odor, but you might get a little wet. But that lets that lymph detox in that area, and not wearing an underwire bra lets that bounce a little bit.
I really couldn't agree more. So we both are acupuncturists by training, right? And incidentally, as I just learned, we both went to Southwest Acupuncture College in New Mexico, which is a pretty cool connection. But in Chinese medicine, we think about the free flow of qi as being essential for health. And so the idea that, anything that's going to be compressive that we're wearing for most of the day is going to restrict the flow of energy and blood to a given area. And the idea of kind of like putting something that's going to basically put a cork in our ability to vent out sweat, and so it's a natural way that the body kind of opens to the outside world and that moves energy to the outside. Blocking that process, jamming it up, seems like a bad idea, just from the standpoint that where we know that qi stagnation tends to lead to heat.
Right, and it's sort of counterintuitive, isn't it, to block something?
Yeah.
And yet we deliberately do that. And then what do we do to find out if there's a problem there? We compress the tissue and traumatize it a little bit more. And then we use ionizing radiation to find that. Now, we don't consider thermograms to be the end all. You should be doing breast palpation. There are times when we recommend mammograms because there's something on the thermogram. If there's a really strong family history of breast cancer, then yes, a mammogram is the answer. But there's not a lot of help with mammograms in dense breast tissue or with women who have particularly small breasts. It can be very painful and traumatizing to the tissue. So there's that. And women with breast implants, the one thing that we need to remember is that the ionizing radiation can weaken the shell, right? A little bit, the breast implant shell. And then what do? Then we compress it. So sometimes when you do those two things together, it can cause leakage. And then, then you have to have that surgery redone.
So that seems like, especially for women with breast implants, it seems like thermography would be an even more important thing to know about.
Right, exactly. Young women, old women, women with breast implants, women with small breasts, women with big breasts, basically all breasts.
Nice. This episode of A Healthy Curiosity is brought to you by the coaching branch of BrodieWelch.com. Yes, that is me. In early 2017, I'm going to be opening up my schedule to coach just a handful of people one-on-one who are interested in showing up differently in the world. If you're wanting to feel more calm, confident, have more energy, ditch an old pattern, set a boundary, or change the one thing that you know will change everything, I would love to support you. Deep, transformative change can be hard, and it's way easier when you have someone in your corner who believes in you, who can amplify your strength, and who has lots of tools in her toolbox. If you'd like that person to be me, email me at Brodie@BrodieWelch.com. That's Brodie with an IE and Welch with a CH, and let me know that you're interested. Now back to today's show. So you mentioned kind of that in the early days, thermography was getting a bad rap because basically it was not being practiced by people who were particularly well trained in it, and kind of like that. Obviously, a tool is only as good as the person wielding it, which is sort of another thing that we in the acupuncture profession are dealing with right now, of like untrained practitioners needling it and calling it acupuncture. So is that kind of the story that people were?
It is the story. There are still a lot of people who do thermography who have no medical training.
Yeah.
Now, you need to have a vocabulary that you can discuss things with your patient, so that when they tell you that they've been diagnosed with a triple negative breast cancer, or their mother had HER2 positive cancer, they have the BRCA gene, that you can actually you actually know what they're talking about, and you can actually answer their questions in relation to that. The other thing that I think is really important when you have a thermogram is that you have a person who does it that can do a breast exam. I know that they have discouraged women from doing self-breast exams. I think that's a real big mistake. A lot of my patients have come and they found their lumps on their own. Sometimes if they've had a mammogram and the mammogram missed it, they have found a lump on their own. So doing a breast self-exam is really important, and having a doctor, when you do your thermogram, that can actually do a palpation and can actually walk you through what it feels like and what you're looking for when you're doing breast palpation, I think is really good, because
it just seems so, sorry to interrupt you, it just seems so crazy to me to disempower women with a tool that could be potentially useful. It's like, why not just, like, if the problem is that people aren't necessarily doing it well enough, isn't the solution in training people to know their bodies better, as opposed to just giving up on that entirely?
Right. I'm not sure. And, it goes in line with the fact that, a lot of women will say, well, we don't check men for prostate cancer or testicular cancer by smashing them between two plexiglass plates and then irradiating that tissue. I mean, they would not stand for that.
Really true.
Right?
Mm-hmm.
So, yeah, I know. It's amazing that we're in the year 2016, and yet in some ways, our medicine is a little archaic.
Yeah. So can you tell me, how effective is thermography? Like, I'm wondering if is it the kind of thing where women could say to their doctors, no, I'm going to opt out of getting a mammogram, and I'm going to take pictures of my breast and see about blood flow? Is that going to sound like crazy science, or like, is there some evidence that this is actually an effective screening tool?
There's several peer-reviewed journal articles about thermography and its efficacy in finding neogenesis or neovascularity, and particularly in its use in breast cancer. So, there are studies that show that it is really effective for that. Do doctors know about that? Some do and some don't, and some find it a little threatening sometimes if it's out of their purview, if it's something that they've not heard of. My suggestion is that, women say, this is the choice that I'm making. I don't want radiation. I don't, it's particularly painful for me when I have a mammogram. And 9 times out of 10, their doctors are on board, and they say, I understand, you need to, their stance, the doctor's stance is mammography is the standard of care. That's what insurance pays for. And so that's what they have to recommend. Now, thermography is really good for finding rapidly growing cancers. It's very good because the changes that accompany cancer, the initial changes are increase in blood flow, inflammation, that type of thing. And those are things that are only recorded with thermography. So heat, the changes in heat, the inflammation, that's only visible on a thermogram. So for inflammatory breast cancer, thermography is the only thing that can find the only test that can find inflammatory breast cancer, because it is not a microcalcification. It's not a change in the structure. It's not a tumor creation. It's actually the breast tissue becoming inflamed. So I think, that a dialogue has to be started where, we work together with people who do mammograms and MRIs and ultrasounds, and we find, the best screening for a particular patient. Now, in New Mexico, where I have my practice, my main practice, I actually have developed a relationship with the local X-ray people. And so, if I see something or I feel something that I think needs to be further evaluated, then I refer them to somebody else. And the person receiving the referral, whether it's the mammogram people or whether it's an ultrasound or whether it's a breast surgeon, because, I feel like that's something that the patient should have. They recognize that, if I'm seeing something, then there's likely something there, and that patient needs to be seen ASAP. So I think we just need to move to a place where we all work together, although sometimes that's hard to do. I think it's really important to empower women and to give women the choice and to give them a voice. One of the things that they need to understand is that a lot of times we can order an ultrasound because that's our preference, right? An ultrasound is just actually using sound waves and pressure to, see what the changes in the tissue are. But a lot of times, wherever you take your mammogram or ultrasound requisition, they won't do an ultrasound without a mammogram. They'll tell you that in order for the insurance to pay for it, you have to have the mammogram. And so that's where, it's sometimes hard for the patient. They have to be pretty firm and pretty ready to say, no, this is my body. These are the choices that I'm making. When you have something going on, if they're talking to a technician, then you can do however you want to do it, or the doctor, right? You can say, listen, doctor, when you have a lump in your breast or it's your breasts that are being examined, then you get to make that choice. But for me, my choice is going to be to do it this way. And so, that's the hard part. And even though we're in the we're in the 21st century, women still feel very disempowered, I think, and especially in relation to their health.
Definitely. I know that I hear from my patients all the time, this sort of the fear of not being taken seriously, of not having their choices respected, feeling like even they might have a very sympathetic doctor, but they feel like the establishment in general, like it's going to be a fight to get the care that they need or to do it the way they want to do it. And there's this sense of really not being in control, which I couldn't agree more, needs to change because it really should be up to the patient in terms of how we want to take care of our bodies.
And one of the things that is in particular to Chinese medicine and to acupuncture is that teeth lie on meridians. We've known that for quite some time. I don't think it's employed as much in acupuncture practice as it could be. Part of that is that the training and, understanding dental pathology is a whole another ball of wax that you don't have time to learn about in the short time that you're in school. I mean, even though it's 4 years of medicine, that's still relatively short period of time.
Can't learn everything.
You can learn that I think one of the most important things you learn in school is that you don't know everything.
No.
You can never know everything, and that's why they have resources and books and other people that you can talk to, and sometimes the internet to help you find those things out. But I studied European biological medicine with Dr. Thomas Rau from Switzerland. And one of the things that I learned was that women with breast cancer, particularly, pretty virulent cancer, maybe as much as 4-stage cancer, could be cured by removing the root canal tooth on the stomach spleen meridian. So I found that particularly intriguing. That was really part of what I learned in that European biological medicine that I found really useful.
That is fascinating and actually really it resonates. I've studied with Jeffrey Yuen a fair amount, and one of the things that he talks about in terms of breast cancer is exactly that kind of like smoldering infections in the teeth and gums, like in the mouth, on the stomach channel. A lot of times, like the next stop as the meridian moves, or for those who can't visualize the stomach channel, that comes down kind of through the face and then down into the neck and directly through the breast. And it's sort of like the next stop from the mouth is down into the breast. So I think that's fascinating that's there. And yeah, his advice was always don't cap the tooth. Just take it out. Take out the diseased tooth.
Right, because the root canal is basically a dead tooth that you're leaving in your body. And what we found is that if the lump or the cyst or whatever is on the right breast, then it's on the right stomach meridian. So it'll be the first and second molars in the upper jaw. So it would be like teeth numbers like 2 and 3, and in the lower jaw, those teeth numbers are 28 and 29. Those are the stomach spleen meridian. Those will be on the right side, and then if it's a left breast cyst, then the teeth numbers are the 14 and 15 on the upper jaw, and 20 and 21 on the lower jaw. So it's always sided, which is, I think, particularly interesting. So if the infection is on the right side, then it's the right side of the mouth that you have to look at. If it's on the left side, then you have to look on the left side of the mouth. So,
that's really interesting. Really interesting. I'm curious if there, as people are listening to this and thinking about their own approach to breast health, how can someone find someone that does thermography if they're interested in finding somebody? Like, what do we look for? What are the important things in screening a practitioner? And is there a way that we can even find practitioners in our area?
You can very easily. I know that there's one of the things I always look to is who does the interpretations.
Mm-hmm.
Whoever interprets the images should be a licensed professional. I particularly like when it's an MD that writes it. There's actually a site that you can go to. It's called www.meditherm.com. It's Medi, MEDITHERM.com. You can actually go on there and you can actually find a practitioner that is doing thermography in your area. I think they're in 21 countries and 48 states. So they cover a good portion of the globe with the type of thermography that they do. And then you may be able to find somebody in your area who's doing it that isn't with Meditherm, but that has a thermographic camera, and you would find them either from a practitioner or word of mouth, I would imagine.
Okay, that's great. Any last tips that you can offer people as far as taking care of their breasts?
So there's a couple of things. We talked a little bit about using a natural deodorant, doing gentle breast massage, avoiding underwire bras, a diet that is low in sugar, a diet that is gluten-free. Those are particularly important things. We've actually done before and after pictures of people who came in and they had some inflammation in their breasts, and we were like, wow, okay, well, that's interesting. They come in 3 months later, and I'm like, everything has changed, and there's like almost no inflammation. And I will ask, what have you done? And they're like, oh, I've been grain-free, or I got off sugar. And the changes that makes in just 12 weeks is astonishing. So I think, healthy diet and exercise and massage is a really good thing. The other thing that I highly recommend for women, actually for everybody, is doing gentle rebounding, the little mini trampolines that you bounce on.
Such good lymph movers.
Exactly. And they're so good for the breast. And I don't, I have a lot of older patients. And so I don't say that you get on that and you're trying to do somersaults on it. You're basically just bouncing, a really gentle bounce, and that'll really pump that lymph and get that stuff moving.
Awesome. If people are interested in staying in touch with you, how can they do that?
So one of the ways to do that is to go to my website. I have actually a website called newmexicothermography.com, and there's an email in there. I think that email is thermography and gosh, I can't remember what that is. It's on the website. It's newmexicothermography.com or dfwthermography.com.
Okay.
So,
we'll make sure that gets into the show notes so that people can find it.
Yeah, that's really the best way. Or they can call. We actually answer our phone 24 hours a day, 7 days a week. There's a lot of different reasons for that. People don't abuse that. A lot of practitioners hear that we do that and they're like, oh my gosh, I don't want, people calling me at 10 o'clock at night. Or 5 o'clock in the morning. In general, people don't. And so it's just reassuring for my patients to know that we'll answer the phone, no matter what time of day or what day it is. And if we don't answer, it's because we're usually on another line and we'll get back to them pretty quickly. So they can call, they can go to the website. We try to be available.
Well, Dr. Carla Garcia, I really appreciate you taking the time to talk with me today and share all of your expertise and knowledge with the community.
Oh, Brodie, it was so much fun to talk to you. Thank you so much for having me on. I really enjoyed our visit.
Me too. Thanks so much. Thanks for listening today. For more episodes of A Healthy Curiosity, you can visit the iTunes store. If you appreciated today's show, please leave us a review. This helps other people to find the podcast. You could also head to brodiewelch.com, where you can find free self-care resources, learn more about Chinese medicine, and let me know what you'd like to hear about on future episodes. I'd love to hear from you. Till next time, be good to yourself.